You're on mute, buddy.
Well, hey, that makes a big difference. I guess we should start over, right? Well,
Probably,
hey guys, it's
probably need a new intro.
I know, long intro for nothing, so I'll start over. Hey, it's Reagan from Altus Emergency Centers, and today we have an awesome topic to talk to you about: back to school illnesses and sport injuries. And Dr. Goffey, why don't you tell everybody about your guest speaker today?
So today, Dr. El Khoury, who's a new neurologist for the area. Do you guys hear an echo?
No, it sounds
No.
good to me, man.
Okay, good. He's a board certified neurologist. He's actually certified. This is a great topic because we're talking about school stuff, stroke and brain injury in medicine, sort of like concussions and things like that for kids. He actually completed his residency in the University of Texas in Houston. So he's kind of local, even though he's from Lebanon. He's a founder of something called NeuroCare of the South that currently has a clinic on Harrison Ave in Beaumont, so right in the St. E building. To me, this is very exciting because NeuroCare sees from 14 and up, right? All ages. He sees patients with all neurological problems: brain injury, concussion, neuropathy, stroke, epilepsy, dementia, Parkinson's. And right now that we have incredible physicians in the area, Beaumont and Altus, everything, but they're really saturated. So to have a new clinic with new doctors and new practice kind of opens up the timeline to get people in. So
Awesome,
it's
awesome.
I'm really happy to have him on the show.
So we'll have him on the show. If you're just joining, we're going to have a new doc on the show in just a little bit. But first, Doc, I have a lot of questions from the public about school illnesses. And one of the first questions I got was, what illnesses are you currently seeing right now on the ER side since school
Yeah,
has started back?
I hate to be a broken record, but even my own kid, came home with COVID. My mother-in-law, my father-in-law came and visited, and he wasn't feeling well, and sure enough, he had COVID. Spread it all throughout the house.
Oh, man.
Now, I might have given it to him, or school might have given it to him, but in general, kids are coming in more often. Now, we're blessed that these new COVID rounds are really not what they were with the shortness of breath. This is not the June Delta, where I unfortunately lost my aunt and things like that. This is more sore throat, migraine, headache. My kid actually said something to me. He's like, "You never believe me when I'm sick. You just say take Tylenol or Motrin and make me go to school." But the truth is that it actually is affecting kids a bit more, and they don't feel well. They have fever, not eating, sore throat. So we're seeing that. Not everybody's testing positive for COVID, but because there's still some immunity, but not much from the vaccines and from the previous ones. But it's COVID. I mean, if you send out, it's people. If people get tested early enough, it is COVID.
Right, right. And guys, if you're just joining, be sure to share this stream, share it to your page or comment. We have a real doctor here, live Q&A that can answer your questions. But what other things are you seeing, Doc? What else are you seeing other than COVID? What are the top illnesses right now in
Yeah, I
school?
would say strep throat and abdominal pain. One of the big things that we're seeing with COVID, or we're just seeing in general, like the water drinking, right? So a lot of abdominal pain, even in adults, right? Like, uh, so they come in, and I'm like, listen, this is could be as simple as constipation or unfortunate things like inflammation of the bowel and stuff. They're like, oh, it can't be. There's no way it's constipated. I go, every day, but sure enough, if you're dehydrated, you take water from the stool. I mean, the large bowel, mostly, and it causes a hard stool, and it causes pain all throughout the right side, left, lower left side, and we're seeing a lot of that. We're seeing about upper respiratory stuff, and then we're seeing abdominal pain.
Right,
So please don't get mad at me, public, when all I say is you have constipation. It's a happy problem not to have appendicitis.
right. So, real quick, so I've been seeing this a lot in the schools as well. What's going on with this cough? It seems like some people are getting coughs and it's not going
Yeah.
away. What's the deal?
This COVID round was probably like 5 weeks where I was coughing. I hope I'm not getting it again. I'm a little nasally with my son just getting it this past week. But the cough is just, it's that drip. It's that nasal drip, right? So it stays here. So it's not long, right? It's just, it's right around here. It's around the throat, the nose, and that drip is just causing, just for you to cough, and it's
Right.
just not stopping.
Can
And
Zyrtec or
there's
any
no, There's no antibiotic that's going to work.
Right.
All right. The biggest thing is some of the physicians out there are prescribing steroid packs. I think it's important to talk about a steroid pack.
Mm-hmm.
They don't really work. They're a small dose in increments of time, and I'm not a really big fan of them. I think if you're going to prescribe a steroid, you prescribe a steroid to its dose. Not the pack that was designed for years ago. So if you ever get a pack, I don't recommend taking it. I recommend taking prednisone, like 60 milligrams for 5 days, and actually get a steroid,
Right.
prescription rather than a little pack. The pack has been failing everybody.
Right. So does Zyrtec or anything like that help with that cough, or I guess help with the drainage?
Yeah, especially in kids. I would say with adults, it kind of still lingers. But the pink eye, nasal, all of those things, it's kind of associated with the pressure because you can't drain, right? I actually bought that weird thing you see on TV. You put it in.
That looks
Uh,
scary. Okay.
it is not easy to use. I tried it. My wife can't use it. My kid can't use it. I tried it, and you're like moving your mouth very awkwardly. But it does filter out a lot of things out of the nose. It did. If you manage to use it, it works. But I don't recommend paying $100
I
for it.
haven't tried that yet.
Yeah, I don't recommend it.
Obi just asked. I have been seeing pink eye associated with this new strain. What's your thoughts on that?
Um, it's the pressure. That's what I was saying. If you
Right.
if you clog everything here, your eyes get puffy. They can
Right.
get
Right.
red.
Right.
Remember, pink eye is they're all pink. All of the viruses cause pink eyes, but it's not true pink eye, which is technically feces going in your eye,
Right.
right?
Right.
That's so. Just because it's the same color doesn't mean it's the same thing.
For
It just
sure.
causes that pressure, so therefore your eyes are kind of
Maybe
congested.
people just think it's pink eye because
Right?
eyes are
Yeah,
pink. Right.
exactly.
So Katie just asked, I'm wheezing every day and night after having COVID over 7 months. I think we kind of talked about this. Maybe is it that drainage that's still causing all of this?
It can be 7 months is a bit of a long time. I mean, one of the big things is kind of look at your life, right? If kids are in daycare or the different ages, I have a girl about to turn 4 and I have a 14-year-old. So I get like double dose of time, right? I get the consistent daycare stuff, and then I get now the new school stuff. If your weekends, if they're associated with groups of people, it's just everywhere. It hasn't gone away. So
Right.
you can still get a mild version, and you're immune to it, but it's still an inflammatory response of getting it again.
Right.
And I think that's the biggest thing to remember. It's you really have to look at what we're doing. It's very environmental now.
So, if these kids get strep or that abdominal pain or dehydrated, is there anything Altus Emergency Centers can do, or the ER can do to help them?
It's a lot easier for someone who's seeing 100 cases a day to point out which one it is. Maybe a simple test if necessary. I highly recommend. Abdominal pain could be a lot of diagnoses. I mean, it could be appendix, could be a lot of things. Even though I say it is mostly constipation, you got to be careful because you don't want to miss appendicitis. That's for
Right.
sure. You don't want to miss a pneumonia. I mean, the most
True.
common reason of a bacterial pneumonia is a previous viral pneumonia like COVID. A lot of people are developing strep throat that does need antibiotics after COVID, just because we keep clearing, right? And therefore, strep lives in our mouth. So if you have that for long enough, you can develop strep throat, and that
Right.
needs antibiotics. It won't go away without antibiotics.
So I guess if you could get a chest X-ray, to find the pneumonia.
Yeah, the swabs, things like that.
And then we could also get a ultrasound if you needed to rule out appendicitis,
Yeah,
right?
yeah.
So
For kids, we usually start there, or hopefully not need a CT, but hopefully it's not appendicitis. But
like,
but we have all the tests that we need in order to rule out all diagnoses associated with these.
so Kevin said, I have never tested positive over the last 2 years, but have been around others with COVID. Why is that, you think? Think it's just not showing?
I think you could be a specimen of health, but there's no way that you haven't had actual COVID. I think at the end of the day, anybody around somebody positive, especially a wife or a family member, you got it. People are not testing positive like they used to for a month, 3 weeks. Now, I will say that there are some PCRs out there that do have people testing positive for a long time, but those are usually false positives, right? Like you've been over the symptoms, you've been over everything. I think the biggest thing is to remember that if it's still a very intimate, close contact. If you're spend a day with somebody with COVID, you probably got it. You just have a good immune system,
Right.
and that's a positive thing.
Right. That's good. So let's say that the kids, are get from school illnesses. Let's say they do have a stomach, stomach bug or this or that. Will fluids or anything help them? I mean, some people can't keep a, medicine down because they're vomiting.
Yeah, the nausea vomiting is real. I mean, you'd be amazed how kids feel better. Adults feel better with some IV fluids. The best thing you can do is get IV fluids. I mean, if you're not eating and drinking, you need to get them one way or another.
Right.
And
I
that's
know.
something that we provide for patients all the time. You actually have done that.
Right.
You've come to
Right.
the ER for that.
Right. Mobile IV fluids was a lifesaver. It made me feel better for sure, just getting the fluids. But I know some people have Zofran or they have some other stomach medicines, but they can't keep it down, so it's not benefiting them. So
Right.
IV
Yeah,
fluids in the ER.
if you go a day or two without fluids, I mean, and you have the ability to come and get some IV fluids, you're going to be a different human. You're going to feel a lot better.
So my question for you, since we're talking about school illnesses, how big of a role does hydration play in sports for all these kids?
Oh man, sports hydration is the biggest thing besides a sports injury where you need to be careful. I mean, if you're not hydrated, all the injuries start to happen. You start cramping, you start not feeling well, headaches.
It
I
affects so
mean,
much, so much.
it affects. So it's such a big conversation that we've had. It was probably about an hour long conversation just on hydration, and it leads to so many problems of not being hydrated. You
Right.
add on these little viruses that make you dehydrated. It's even compounded to its importance of being hydrated.
Right. And if you're just joining and you're just watching, we were talking about earlier, constipation can also be caused by not having enough fluids,
Yeah,
It's
absolutely.
crazy how it's all connected. Chris just said, my husband just had COVID for the second time, but she escaped it.
I don't believe you, Chris. I think
Oh,
you had it.
oh wow.
If you guys sleep in the same bed, I think you didn't have symptoms. I agree. It's not like a conspiracy or
Symptomatic.
anything like that. I believe in the end, our immune system is strong. As a physician that works 24 hours, I see a lot of things and I don't get sick with every person I come in contact with. But when I become depleted, like if I work, a couple more days than I should or things like that, if you're tired, right? If you're a rested individual and you go in and people around you are sick and your body's ready for it, it fights it. But if you're stressed out for whatever reason, the job started to get busier, all of those things have a factor,
Right.
right? And it can get you sick. I mean,
Yeah. Right.
that's the biggest thing.
Yeah, it'll catch up with you for sure. You get run down, your immune
Absolutely.
system gets run down. Blake, thanks for joining. Thanks for the great info, Doc. Hey, Blake, thanks for tuning in. And if you're just joining, be sure to share this stream, guys, so other people can hop on, ask questions with the real doc. Dr. Goffey's here. Heather just said, I have yet to test positive for COVID, and I have been taking care of COVID, positive patients for 2 years. I think my genetics play a big role. If that's the case, we need to sell her blood. She may,
That's right.
perhaps.
I think. Listen, I think it does. Again, I think it's if you look at yourself and say, "Hey, I have good genetics. I'm healthy. I'm active. I do all these things." Then I think you just fit in that other side where you take care of your body and you take care of things, and your body's ready to fight things, right?
Right.
And I think never forget that. I mean, if you're an individual that takes vitamins, you're an individual that works out, you're an individual that goes to bed on time every time, doesn't have a job that keeps them random hours and you rest all the time, you're ready for things like this,
Right.
right?
Right.
And it's genetics and environmental.
Guys, we're about to bring on Dr. Rami here in just a few minutes. Don't go anywhere. We just have one more question here. Do you recommend hydration packets that you can put in your water bottle? What do you think about those,
Yeah, those
guys?
are great. I think those are great. I think at the end of the day, water is enough, but those liquid IVs really are good. I have lots of friends that take them, over the weekend and stuff, especially after if we do like long runs and things like that. I think they're great. I think really what you need is water, right? But if you're nauseous, those hydration packets have a bit of flavor, so be careful. If you're going to take one thing down, I would say at least take down water. But those hydration packets are filled with good electrolytes. That's not your daily drinker. It's a recovery.
Right, for sure.
It's like Gatorade, right? You don't need Gatorade every day. You need it to recover if you have a big illness.
That's a good way to put it. Good way to put it. Well, I'm about to bring on Dr. Rami. If you want to give him an introduction, you ready, Doc?
Yeah.
All right, here we go, guys. All right. If you're just joining, why don't you tell everybody, Dr. Goffey, what he does and a little bit about him.
This is Dr. Rami, who I introduced already a little bit in the beginning, but I think he's important for the community. He started a new clinic. He's at the St. Elizabeth Buildings, a board certified neurologist. All right. He's certified in stroke and brain injury. But the biggest thing is he takes care of anything 14 years old and up. That is most of our football injuries, especially football injuries, but neuropathy, stroke, epilepsy, dementia, Parkinson's. It's our grandmother, our mother, our parents, and our kids. And I think it's important. He started a new practice, so he's got availability. And I think that's big. A lot of us don't think about our migraines as a problem, but they could be. And therefore, I think he's great to add on. And he's someone to come and see and introduce to everybody, because I really like the way he's practiced. And I have a bunch of friends that know him from Louisiana, and that really comes highly recommended. He's come into the area, and I've met him a few times, and I think he's fantastic.
And he's pretty good looking too. I mean, he's not too bad.
Look at that. And he's wearing his. I need to upgrade my game. I need to wear a tie.
I don't feel like I'm dressed good enough. And so, where's his office at? Is that in Beaumont? You said at St. Elizabeth?
Yeah, you're correct. St. Elizabeth. It's on the second floor. We've been there about 4 weeks. We're very glad to be part of the community.
Welcome, welcome.
And thank you very much.
So Kevin says, welcome to Beaumont. How about simple migraines? How can we get an appointment with you?
Absolutely. You can see us if you call for an appointment. I'm going to give you the number right now. We have a 1-800 number, and you can see us within a week. And we'll be happy to see you. We see migraine patients, and we know how migraines can affect activity of daily living. So yes, we'll be happy. We'll be happy to see you. And there's a lot of options now for migraine care. And the number is 1-800. If you would like to write it down, 547-3073.
And Dr. Alkhouri is also he's helping us at Altis. So we're actually able to refer patients. If you do come in, we're also able to take care of that for you guys. Taking care of referrals over to him as far as anything really neurological. And it's been a really good, easy, seamless process. So it's been great working with him.
Right. So
Absolutely.
my first question for you is, can my wife cause migraines for me? No, I'm just joking. If she's watching, with all seriousness,
be careful, Reagan. I think
right.
you need to be careful.
Careful. I don't think I have an answer for you.
Yeah, right. Probably we'll talk after the show. No, but with all seriousness, do you see a lot of concussions with sport injuries from children or kids, teenagers?
Yes, we do. It's actually pretty common, unfortunately. One about 1,000 per 100,000 is the incidence. We see it, and really the range of symptoms from concussion is very wide. People can have headaches, dizziness, difficulty focusing, nausea. It's really, vision difficulties. Really, a lot of symptoms.
Yeah, and that's kind of like the biggest thing that him and I work together with. It's someone comes in and they had an obvious injury right on the football field. And then it's my job to get him to him, because it's not about what we see the first day. Like, I might see it first, but it's really, how long do you need to wait to get back out there to prevent it in the future, right? I think that's the biggest team play that physicians do, is when can you get back out there? And I know it's tough for kids. It's very tough for kids to tell them, hey, 4 weeks, 5 weeks, and they may even feel okay. But the last thing either one of us, Dr. Alkhouri or I, is getting out too early and then being prone to concussions. And that's our biggest fight, I think, with kids, and not fight with kids and parents, but they do feel good, right? Your kids feel great, but it's just, they're not ready. And I think that's the biggest thing that we would like to give to the community, is the comfort in our recommendations across the board, both from the ER to the follow-up.
Right. So let's say the doc,
100%.
let's say a kid comes in, with possible brain injury, Dr. Goffey. So you can refer them to him, right? I
Yes.
mean, help them
Uh,
get that
Yeah.
continuation of care.
Correct.
100%.
That's awesome.
Dr. Guffey and the Altus Hospital we have a direct communication, and then he tells me who he would like me to see
Mhm.
as fast as possible,
That's good.
who
That's
can
good.
wait. We're in direct communication on a nearly daily basis,
Because you
actually.
may only see him for a day, Dr. Goffey, but
Yeah, well, I see it for an hour, and
Right.
then the best part is Dr. Alkuri is really committed to our community. He's hired himself. He's got nurse practitioners. I think
100%.
you could tell us about the staff. I mean, he's got. There's always going to be somebody associated with being able to see you, even if it's the next day that he may not be at the clinic because he's somewhere else. And I think that's the beauty of the relationship is there's always someone there, right, ready to see you.
Right.
100%.
Right. So
100%.
Kevin's curious. Who's all on your team, Doc?
Okay, so we have obviously our support staff that helps us, but our providers are there's Dr. Azar, who's a neurologist and an epileptologist subspecialty. We have a nurse practitioner, Juliana Doe, who's great. We have Meg Brown, that's going to be starting very soon, so second nurse practitioner, and myself, and we're growing the team as much as needed to serve the community.
Right. Right. Sarah just said, some of the common activities that we see in our area include football, soccer, horseback riding, and even riding, four-wheelers. What are some of the participants, what can they do to reduce these brain injuries for all these kind of activities?
uh, Obviously be very careful. Be If they've already had some type of brain injuries, to watch for signs of symptoms to know when to be able to return to the sports they do. Obviously, helmets are extremely important. And
I have a bag here. I was going to put a helmet on.
Yeah.
Maybe not for
yeah,
soccer, but the
uh,
horseback riding and
uh,
football for sure.
yeah, but
ATV.
let's make sure they don't use the same helmet you were showing
Yeah,
us.
no, use the real one.
They'll be short. They'll be short of breath.
I just bought a new printer, but I think it's very important what he said. It's the precaution is one thing, but the follow up is just as important. I trained in Arizona, and this is one of the big things that I liked when I talked to Dr. Alkuri. When I trained it was part of the Golden Gloves boxing. So they had a book. Every athlete had a book in high school football or Golden Gloves boxing, and anything happened in an event, it would be written on there. And until they were cleared, they had a minimum of 6 weeks before going back to any activity. Like, let's say a family didn't take them to a neurologist or take them to family practice. So they had a minimum of 6 weeks in between an incident before they can go back on the field. And,
Yeah,
and that was on purpose because it was a big deal in Arizona, the injuries that were happening. And I think that as easy as it is and as good as it is for people to say, hey, you have a concussion, there's nothing more important than the follow-up weeks to make sure they prevent it in the future.
100%, and that's part of our role. We
Right.
we are in the community to be able to give more guided answers and more evidence-based answers and more patient-oriented answers as well. So
Right.
this is very important.
So, Doc, do you utilize telemedicine at all?
Yes, we utilize it a lot. To tell you honestly, we about 50 to 60% of neurology in general, we probably a bit more than that. We like to see the patient at the first visit if possible, to see them in the clinic, to get an exam. There's some limitations that you have for telemedicine. Some pathologies like migraines are a little bit easier to do without an exam, but something like a neuromuscular disease, something like movement disorder like Parkinson and things like that, you really need to check tone of the patient, etc. But the answer to the question is yes. Telemedicine is a huge part of what we do, and I think it's a very strong method for access of care.
Awesome. Um, Obi wants to know: have you seen the marshmallow padding on football helmets? He wants to know if that works at all, if that helps. The marshmallow.
Yeah, I saw that.
Uh, uh, so, I think then it, it's hard to say, to tell you honestly. Um, I hope that they do work. It's probably they'll be able to take a little bit of absorbing the trauma, but it's hard to say. I don't have a straight
I
answer.
think, yeah, I think it's complicated. I think some of the pros are using it, but you forget that there's still a 400-pound, 6'8",
Yeah,
monstrous man, coming after you. I think at the lower levels, any cushion is better,
Right.
but I don't think that in the pros you're going to see
I
less
guess it
traumatic
can.
brain
I guess it
injury.
can only do so much.
yeah.
Yeah, I mean, these guys are so precise and so trained, that it's avoiding a head injury is really the best thing for it. But it's impossible to do in football. It's a rough sport.
Well, Doc,
I
before you
agree.
get out of here, one more question for you on
Absolutely.
brain injuries. How important is it for these kids to take adequate time off if they get a brain injury?
So the answer to your question is extremely important. Okay, a good timing. It's one. Bad timing increase risk of new injury. Okay, bad timing increases risk of not performing as well. Bad timing decreases the chances of healing for the body. So it's crucial to know what to look for, when to wait, when to evaluate, when to do imaging, when to do. It's really a science and a part of medicine that needs to be taken extremely seriously, especially for our younger population, younger patients and younger people. So yes, the answer is very important.
And I think it's important to remember that it's that week or two that you feel fine. That is the most important 2 weeks to take off.
Mm,
It's not that, hey, they resolved 2 days ago. I'm good, Dad. I'm good, Mom.
Hmm.
It's the 2 weeks after that that are the most crucial weeks. And they're the hardest ones to fight as a family. I know. I mean, I played sports. I played sports as a kid. I had a concussion as a kid. I played hockey. My dad played pro hockey. I mean, like it is something that it is crucial to recovery is actually 2 weeks post feeling okay.
Right.
That's the time, right? And as parents, you want your kid to play, especially because they never come at an opportune time, right? They always come at the final 2 games of the season, or the first 2 games of the season, and you want to get them back out there. And I think that's what he's saying. It's the most crucial, most important time, but it's also the most complicated time as a family.
Right.
And that's why it's important, the communication between myself and him, to
yeah.
to give that education so that we can all stay strong and taking that time.
Yeah. I don't think you're trying to scare anybody, but you're
Um,
serious about this
yeah,
window of time. There's really a
yeah.
short window of time, and it's really really crucial, like you're saying. So, wow.
100%.
Yeah. So very important. Very important. All right. Well,
Dr.
Dr.
El
Goff,
Khoury, it's been a pleasure having you on here. I don't know
Uh,
if we have any other questions left, Reagan, for us, but Dr. El Khoury, thank you for having us on
hey,
and going on everything.
before you leave,
I
Doc,
hope.
let's see. I had one more question for him. Somebody wanted to
Absolutely.
know your times. Let me see. Oh, go ahead and tell everybody what your days and times that you're open before you
Okay,
got off.
so we are open currently Tuesday to Friday, 4 days a
Tuesday to
week,
Friday, 4 days
and
a
we're
week.
expecting October 1st to be open Monday to Friday, 8 to 5. So we're going to be
Excellent.
5 days a week available, and we prioritize seeing patients as fast as possible.
Awesome, awesome. Well,
Excellent.
Dr. Goffey, thank you for bringing your awesome guest on here today. It was a
Thank,
pleasure meeting you, sir.
I'll
thank
stay
you.
on for any other questions. Dr. El Khoury, it's been a pleasure, okay?
We'll see you
Same.
around.
Thank you.
All right, Dr.
Re-
Goffey.
yeah. So, again, I wanted to say, I know we switched into a little bit of sports injuries, but I think it's important to really combine the things that happen. It's our first time we have a guest, so naturally it was a little different. Hydration, hydration, hydration for kids. Nothing is silly to go to an ER for. If you're having a fever that doesn't want to go away, you've done everything that you can at home, Tylenol, Motrin, or you feel like your kid is really having a sore throat like he's never had before, a headache like he's never had before, a cough like he's never had before, please bring them in. We provide free medical screening. It's what we're there for. We're there 24/7, and there is no silly question. I've said it before. I took my kid at 3 days old. The one thing not to do to an ER because she wasn't taking on the breastfeeding. And sometimes you just need the reassurance. Okay. Sometimes you need a test, and that's what we're there for.
Right. Peace
Um,
of
and
mind.
and we're building a great team. We have the cardiology team. We have the neuro team. We've upgraded the CT scan machine for a lot, better imaging, everything. I mean, it's state of the art. It's incredible. And we provide free medical screening. I mean, we're doing everything we can for the community, and we're there for you.
Awesome. And Doc, before you get off, somebody just asked, how important is it to stretch before, football or any kind of sports? How important?
After a person who just went to a chiropractor today because his biggest issue is not stretching, don't practice what I preach. I mean, practice what I preach, but I wish I did. I wish I did stretch more. The best shape. I'm in good shape because I do things, but not because I feel great after them. When I did Pilates and yoga on a regular basis, you just feel, you wake up better, you feel better, your energy is better. Uh, I hope, I know kids aren't listening that much, it's mostly parents, but if they could just do 5 to 6 minutes a day of stretching and you join them, you set up a habit for life that is, my parents never did
Right, right. Getting
that.
that habit, those good habits for
Yeah.
sure. Hey, so what if they do get hurt? Is there any, with muscles, is there anything we can do to help that at the ER if they're hurt? I guess broken bones for sure. We have a
Yeah,
CT,
absolutely. I mean,
X-ray.
X-rays if we need it. We have neurology if it comes to that. We have imaging, right, to see. I mean, if a ligament's torn, and sometimes it's MRI, but initially, we can do tests there to say, hey, you really need one. If you're not better in a week, get this done. But also pain control. I mean, adults, like how many times they twist an ankle or things like that, especially at the lake on the weekends, and the pain is just unbearable, and you can't sleep, and we can take care of all those things for you.
Right, for sure, for sure. Well, Dr. Goffey, thank you so much for joining and bringing your guest on, your guest doctor that's new to Southeast Texas. We're going to be glad to have him. And thank you guys for tuning in and watching. I appreciate it. And we will see you on the next Doc Talk. And be sure to post things that you want us to talk about. Any questions you have, we'll be happy to answer them. And hopefully we can do a Doc Talk video on it next time. So.
Yeah, I have a wide range of knowledge, or I'll find out things. I mean, it could be off ER topic. If you guys are interested in a topic, anything you guys want, we'll bring it up. I mean, it's not, we're not filtered to just ER. If you have something primary or have something gyne, anything of those things, we see those, believe it or not,
Right,
in
right.
the ER. So happy to think of even off topics that you don't think are necessarily emergency.
Well, Doc, I appreciate you. We'll see you next time, man. Be careful.
Take care.
All
Have a
right.
good weekend, everybody.
Be sure not to get hurt again, so you don't have to go to your chiropractor. Try to
No, yeah, it's kind of one of those things. Unfortunately, when I
stretch,
do get
stretch,
an
stretch.
hour, yeah, I got to stretch. So
All right,
take care,
man. We'll
everybody.
see you. All right, bud. Guys, thanks again for tuning in. Again, I'm Reagan, and I'm with Altus Emergency Centers. And remember, we're here 24/7 for all your emergencies. It doesn't matter what it is. We're here to give you peace of mind, take care of your family, and get you feeling better. We have, like he said, Dr. Goffey said, free medical screening. So if you ever have any questions, you're concerned, you're not sure what to do, what the next steps are, come to your nearest Altus location. We've got you covered. We will roll out the red carpet, and we will have somebody waiting for you to take care of you and give you that peace of mind, so you know what's going on with your child, your husband, your wife, anybody in your family. We take care of all ages, from pediatrics all the way up. We're here for you guys, and we got you covered. School's back in session. Any illnesses, any sicknesses that you think your kiddo might have, we can help you take care of those, get them feeling better. And, it was awesome having that neurology doctor today, Dr. Corey. He's in Beaumont here, and he can, even do telemedicine with you for any concussion concerns, any kind of injuries that may be related to that. He's awesome, and it's great to have him. So we got you covered, guys. We got you covered for the continued care. So once you leave here, we can make sure that you get followed up and taken care of to keep you feeling well. But anyway, guys, like I said, leave a comment, leave a suggestion. Let me know what you guys want to hear on the next Doc Talk, so we can make that happen. And guys, we love our community. We love you guys, and we're here for you 24/7. And I will see you next time. Y'all be careful, guys, and take care.